Well, the World Oncology Forum is a project which was launched by the European School of Oncology 5 years ago with the aim of discussing the situation of the global fight against cancer. And the first time when we met in 2012, we asked the experts the question, are we winning the war against cancer or not? And the answer was very mixed. The number of deaths because of cancer worldwide is continuously increasing, and cancer has now become the health problem #1 worldwide.
The key things that we're seeing now is cancer becoming the leading barrier to increasing life expectancy. So we have 14 million new cases worldwide in 2012. We project that this will rise to something in the order of 23 million by 2035. That's a 60% increase. Well, there's going to be large increases in countries that currently perhaps don't see cancer as a major priority.
This time we do not want to have just a photograph of the situation, but we want to try to find out which are the solutions to the problems, and mainly what do we need in order to efficaciously tackle the challenge of the cancer as the global problem #1 in healthcare.
If there's going to be one take-home message from my presentation, more of the same, even with more money, is just not going to work out. We need to really think very differently of how, not just how we fund cancer, but actually how we allocate the resources that we have.
In order to get the attention of policymakers for investing in expansion of cancer prevention and care, we need to make an investment case. We need to demonstrate to them that A, there are a number of solutions that can be implemented, and B, we know how. Because the ministers will be interested, what can I do on a Monday morning? If they're convinced that the burden is high, there's a sense of urgency, and this is a societal challenge that needs to be addressed. But having defined problems, we need to also come up with solutions, very pragmatic solutions that are feasible in different settings.
You know, I heard 20% of health spending is wasteful. We don't know exactly which drugs work very well. Cancer is expensive. We are complicated. All these are perfect excuses for people not to invest in cancer. I think probably running Hong Kong is far more complicated than running health cancer system. I think we need to simplify cancer. I think we need to give an impression that we know how to do it. There's a lot of knowledge we now have to apply. I think we shouldn't be afraid to develop new models of care, to use modern technologies, to do things differently. We need to engage younger generation. We need to give them a direction and show them that engagement in global cancer both is fun, productive, and important. I absolutely love the discourse that investing in healthcare produces economic benefit.
Cancer is complicated. This is not something we can take care of by sending 2 people into a village and doing a survey, which is how we dealt with tuberculosis and HIV and malaria. But it's things like education, screening, imaging, chemotherapy, surgeons, etc. And all of these pieces have to be in place in order to take care of a patient with cancer and make them survive. Okay, so here's my first really important point. $21 trillion by 2035 that will be lost on NCDs in LMICs, low middle income countries. And my argument is it doesn't matter what the investment is, we're saving $21 trillion. And so we really don't have an economic argument not to try to take care of NCDs and cancer.
With the national cancer control plans is there's a significant long wish list of things that are needed. And countries struggle with that concept of what do we prioritize. So they list everything. And then they're told, here's a general price tag for cancer in your country. If you invest $100 million, you'll have a return on investment of 8-fold. But how? How to translate the budget into an operational principle of priorities and implementable actions is the tricky part. How can we define 100 or 50, 200 priority interventions and assist countries to understand what is the impact of those interventions, what is the feasibility given their health system capacity, and what is the cost? Because without that information at the country-specific or frankly even at the region-specific level, we will struggle to have governments invest in cancer in a practical sense.
Many countries in the developing world, they don't have the human resource expertise in management, how to strategize, how to formulate a customized national cancer control plan. In many ministries of health, you just don't have that capacity. And so what happens when you don't have a plan? It becomes like a drop in the ocean here and there, and no impact. But at the same time, the global health community also has to make a plan. And coming from the developing world, in my experience as a former director of the King Hussein Cancer Foundation for 15 years, I also saw how the, let's say, the support coming from the global community, how it takes place. It's also very ad hoc. It doesn't start with the needs of the actual country.
The major thing for me, working in cancer surveillance, is cancer data for cancer action. We are in a situation still where 1 in 3 cancer registries are of high quality. 1 in 5 countries can currently report high quality mortality information to WHO. We must change this, because if we don't have the plan, the compass, the direction of where cancer is going, we're not going to be able to really see if we're making a difference. So we've developed a global initiative for cancer registry development as a means to support countries with their own surveillance plans.
We've been pretty dismal in our support of global cancer, actually. We put a hand on heart and look at amount of money we have transferred into building capacity, training fellows from countries, supporting IARC in delivering cancer registries, 15 million. You know, we give that as a single fund to a grand challenge, and yet they're going around with a begging tin. It's really embarrassing, frankly.
I asked 15 very impressive ministers of finance during the last course. How many of them had heard of universal health coverage? They're the ones who are making decisions for new financing. Only one had heard of UHC.
Most global leaders or most organizations come into a country, they will simply have a one-off meeting with the minister of finance or the minister of health. But it is also important that the people who work with them, they've got the permanent secretaries, they've got directors, they've got program officers who are equally important to understand this agenda. It is the role of the team at the Ministry of Health to also facilitate or help the people at the Ministry of Finance understand what the benefits are in investing in cancer. It is also that the different programs that are being broached to a country are also in line with what those countries see as priorities. And I think it's about time that when you're having these discussions as global leaders at national level, that the team that works around these political leaders is equally informed. It is important that people from the global level are able to work through with them to come up with a plan and let them decide what is really important for that country. Those are the people that are usually missing in the picture. We talk to the top, but the bottom has no idea what we discussed.
If you take the example of South Africa, the Minister of Finance does not talk to the Minister of Health. And then again, I mean, why should he invest in cancer? National cancer control plans, called strategy plan program, most of them, they do not have a budget.
From an Australian perspective, we did advocacy cross-ministry, so Treasury and Health. We were able to show to Treasury that was going to be $2 billion saved over a 25-year period and 84,000 lives.
There are other cancers that we will not be able to show any economic benefit, never ever. So these are not the ones to pick. And you can make a case for young women who are the mothers of families. This is the obvious target, and that's what everybody understands. And anyway, if we don't invest in women, this world is lost. So let's not invest in the males above 70 years old because they vote the wrong way. No, we invest in young women who will preserve society. And then you have a political story that everybody believes and understands, and you have a pro-cancer fight case. Otherwise, who takes us seriously?
I think even us economists in health make the wrong economic pitch. We talk about cost effectiveness, we talk about cost per dollars and things like that, and Minister of Finance want to talk about jobs. productivity and people left out of the labor market. And I think we need to change the way even the economic pitch is made to be much more in line with what the people in Ministry of Finance, in Ministry of Economy, Prime Minister, normally talk about.
More often than not, we forget about non-state actors. So we want to deal with government institutions. These institutions have people who are moving on daily basis. So you send money there, the next time you come to the country, that person is not there. So you can't trace anything. But if we would look at agencies or institutions who might not be moving, we will make use of the little funding that can be given to a country and move forward. If our figures will continue to be that bad, it's going to affect the global picture, whether we like it or not. And we are in this boat together.
From my brief experience with politicians, they will ask for solutions. So they say, okay, so what do I need to do? So how can we help in this process?
I was 20 years ago at the World Bank asking about cancer. Well, they were not interested. No, well, cancer, there is nothing that we can do. 5 years ago, well, let's discuss about cervical cancer because this is economically sound. The basic problem in making our position is that if you go to the G20, give us some money to invest in cancer, that doesn't work. You have to say to them, well, we have 5 priorities. We want a tobacco-free world, we want a cervical cancer-free world, we want to have the majority of women with breast cancer cured, the majority of children with tumor cured, and the majority of people covered by cancer registries. Right. These are 5 priorities, and we can calculate how much that costs. But if we simply let's invest in cancer, nobody's going to listen to us.
I would very much recommend uniting behind the campaign for universal health coverage. I think this is a theme that is resonating with political leaders across the world, helping the ministries of health to articulate the case for more public spending.
And universal health coverage being quite simply everyone getting the health services they need without suffering financial hardship. And of course, as the disease burden is shifting and sort of more sort of deaths due to cancer are occurring, it really should be the case that universal health coverage must include cancer services. I think there are a number of big lower middle income countries now where the majority of people who don't get cancer services now live, that are actually spending only about 1.2% of GDP in public health spending. So this notion that cancer services are too expensive and that the developing countries can't afford them is absolute nonsense.
Universal health coverage is the theme that is taking preeminence in the global landscape. And within the cancer community, we haven't figured out exactly how we're going to position ourselves within UHC. We talk often about basic packages being the starting point. How are we going to ask governments to define the basic package under UHC? But as part of the cancer contribution to health services, I think we can also look at how does cancer help the health system? Building infrastructure in cancer is not just about building capacity in cancer. How does it improve diagnostics, health services across the board? I think it would be a useful platform for us to agree on what are a minimum set of data elements or reporting mechanisms that we can start to define success stories. Because when we think about what works for donors, they need to know that their investments make sense. So maybe we can use some of the experiences around the table to start talking about how some of the implementing bodies here have in fact saved lives.
UICC has just launched a fantastic initiative called the City Cancer Challenge. And I believe in it so much because it starts with a plan. So this City Cancer Challenge does 2 things. First of all, it demands that the national country itself takes ownership, because without political will, absolutely nothing will happen, we know that. So it asks the country, are you willing to invest in cancer? The second thing they ask them, will you work multi-sectorially? Governments, NGOs, influencers, mayors, ministers, and international business, all on one table. So once they abide by these two conditions, then UICC comes with its wealth of 1,000 plus members. They facilitate for them how to do a self-assessment plan. What are the gaps? What are the needs that they need? And then after that, they help them to an action plan.
54% of the world's population live in cities today, and that by 2050 that will be 2/3. Most of this urban growth is in low and middle income countries. We've been told by our members, particularly in low and middle income countries, is that lots of people with lots of good intentions come into their countries and undertake pieces of work that in and of themselves might be important, but don't lead to sustained change over time. And one of the fundamental paradigms within the City Cancer Challenge is about self-determination. Our ambition is that we want to transform the global cancer treatment paradigm. So we want to achieve a paradigm shift.
I really think this is an opportunity, and maybe for the next forum we can bring in or have a table for private sector, big global companies. Because you're talking about Africa, you're talking about Mexico, China. I mean, 75,000 employees I have there. We're Fortune 100. We're nothing compared with some of the big companies. And cancer, again, is the second most important part of our budget.
More conversations like this and elsewhere, where we try to bring the ecosystem together to come up with really effective solutions rather than a rather antagonistic battle that tends to be waged in the public press and sometimes in the literature as well.
We are here for different reasons, but at the end of the day, it's all about the patient and about really our struggle and fight to have a better life and survival for our patients and all of those who are affected by cancer. How do we measure the success of this meeting? I think Franco would like to really have a plan of actions, some precise steps and points of actions that we could take and take it to another level.
The message I would like to come out of this conference is to call on the global health community to change the way they support developing countries. They also have to look into themselves of how they do that.
I think it would be helpful if internally we say, how are we going to track our own progress? Not just to meet again in 2 years, but at 6 months, let's have an internal reporting mechanism so that we can tell each other how have we done and hold ourselves accountable as we ask others to hold themselves accountable.
Participants want to have priorities, not just that we ask for more support for cancer, but we have to specify priorities which must be endorsed by an important social movement in order to convince authorities to follow the lines that we are proposing. We will be preparing a short summary which will include priorities, will include an appeal for universal coverage and for innovation. We should have more resources going into the healthcare structure in general, but which should be earmarked for the treatment and the diagnosis of cancer.